Drew Wilkinson. I am currently the Director of Laboratory, also Emergency Department and Ambulance Services at Boone Hospital. I've been in my current director role for 7 years. Been in the laboratory for the last 12 years. Started out in the laboratory after college and expanded into, started out with a customer service role actually, helping our physician offices and clients, and then grew into an outreach manager type role before I became the director 7 years ago. So have grown up at Boone and have said yes to many opportunities along the way. Boone is in a unique location. We are in the heart of Missouri. So we serve 26 counties around our main Boone County. We are a 394 licensed bed hospital. We are solely independent now, separated from a larger health system a few years ago, but now we are a government county-owned hospital system right in the heart of Missouri. So 26 counties, a lot of that is rural Missouri. Being rural, there are a lot of patients from all those counties that kind of come to our central Missouri area for their healthcare needs. It's kind of a healthcare oasis. And so we had to get creative on how we brought care to those patients. Previously, we did not have a wide footprint. We kind of made the 26 counties come to Boone, but we know that's not the way, it's not patient-centric. And so we wanted to take that care to those 26 counties. In 2017, there was an independent laboratory, pathology laboratory in town that had been serving the area for 30 plus years, and that sold to a national lab in town. And we knew at that point in time, based on the reputation of that lab and the physician offices that we were in our community, that we had an opportunity to kind of serve our patients locally. Our team got together quickly. Boone really started to say, hey, where do we need to go quickly? We went into medical office buildings where there were a large medical presence, and that's when it kind of started our outreach growth, and we just knew there was a need. And so we used Mayo resources actually to hit the ground running. We ran faster than we thought we knew how to run, but we knew we had to do that for the patients in our area. That pre-2017, 2018 timeframe was critical for us to really expand and get a strategy in place. And we tapped into every Mayo resource we had at that time to kind of get our strategic plan going forward. And we've not let up off that since then. And so one thing that Boone has done well is to establish primary care networks, specialty care networks, so that really the patients have access to that care that they need without having to go to larger cities like St. Louis or Kansas City, that they can stay right in mid-Missouri and get that. So we opened up a variety of primary care clinics and specialty clinics within the area. As we opened those up, we saw the need to add existing draw site locations to those. And so we went from having just our main hospital outpatient draw site at the main hospital to opening up 9 additional outpatient draw sites. So one thing that really has started since 2018 when we started opening up our draw sites has been the 10, 15, 20% growth year after year in all of our lab services. And so that's huge. We have grown our outpatient lab world nearly double in those last few years since 2018, which comes with its own challenges internally. We have a fantastic lab space internally at Boone, but we had to look at all of our processes and making sure that we had the right staffing on the right shifts. Mayo also has resources to help with that when it looks at staffing models and courier logistics, and so they've been instrumental in helping us with that. We are serving more than 300 patients a day in all of our outpatient draw sites, and so we know that we are truly impacting mid-Missourians in the healthcare that we serve. We see it year after year, and it doesn't look to be letting off. So we're constantly looking at our market area. One new branch for outreach for us has been looking at other smaller hospitals within our 26 county area. We've partnered with them and we've actually become their reference lab for these smaller rural hospitals. And in turn, the testing we don't do, we send on to Mayo Clinic. And so we have affiliation agreements with 3 smaller hospital laboratories that we do reference lab testing for. And so that's where we kind of see the next phase going, is the larger clients, other rural hospitals that want to partner with us because of the Mayo name. That is a name that our patients like to hear. They don't always know that that was our primary reference lab, and so testing that we don't do or resources from Mayo Clinic are available right here in mid-Missouri. So that's been a great addition to helping not only provide the diagnostic care to our patients, but making them feel like they are truly getting the world-class care within mid-Missouri.